Your cholesterol might be normal, but you could still be on the path towards a heart attack, and the scariest part? Most doctors aren't checking the tests that actually predict your risk. Heart disease is the #1 cause of death, and it's almost entirely preventable if we look at the right markers. Today, I'm going to show you why advanced lipid labs like apolipoprotein B100, called ApoB, and lipoprotein(a), called Lp(a), and scans like coronary CT angiography are the most important heart and vascular tests almost no one is getting. If you care about living longer and staying out of the hospital, this video might be the most important one you watch all year. I'm Dr. Kabir Harricharan Singh, a physician practicing medicine that focuses on prevention, precision testing, and high-performance health before disease shows up. Although I'm a doctor, I'm not your doctor, so please check in with your healthcare provider before making any changes to your healthcare regimen, as this video is meant only to be educational and not medical advice. Through your interaction with the healthcare system currently, you've probably been told your LDL cholesterol, often called bad cholesterol, is the number that matters most. But here's the truth. LDL cholesterol is a population-level metric, not a personal risk predictor, which is why people with normal cholesterol still have heart attacks every single day. This is where advanced labs like ApoB and Lp(a) come into the conversation. To make this a bit easier to understand, think of LDL cholesterol as a ballpark estimate, but ApoB is the actual count of how many particles are capable of entering your artery walls and forming plaque. So measuring ApoB tells you exactly how many plaque-forming particles are circulating in your bloodstream. Why does this matter? Because a high ApoB means a higher risk, and a low ApoB means a lower risk, which is why ApoB is the single best predictor of cardiovascular events and outperforms other lipid tests like LDL, HDL, triglycerides, and even non-HDL cholesterol. Now, ApoB is critical, but there is another marker that's equally important yet rarely discussed, and that's Lp(a). Unfortunately, a lot of people have never heard of Lp(a), but if ApoB is the number that drives plaque, then Lp(a) is the accelerant that makes that plaque unstable. So, a high Lp(a) increases your risk of stroke, heart attack, and aortic stenosis, and your levels are inherited, so lifestyle changes alone won't fix it. Here's the worst part. Most doctors don't test for Lp(a) even though 25% of the population has elevated levels. That's 1 in 4 people walking around with a risk they don't even know they have. So, we've covered the blood work, the invisible markers circulating through your body, but you can have perfect labs and still have significant plaque buildup. That's why we need to move beyond labs and actually look inside your arteries. Now, let's talk about imaging because labs only tell part of the story, but pictures tell the truth. A coronary artery calcium score, also called a CAC score, is a quick, non-invasive scan that detects calcified plaque. A score of 0 means extremely low risk, and a high score means it's time to take action. But if you want a complete picture, the gold standard that shows what's actually happening inside your coronary arteries, that's where coronary CT angiography, also called coronary CTA, comes in because it's a next-level test. It shows actual soft plaque, vessel narrowing, inflammation, and the type of lesions most likely to rupture. It shows you the true state of your arteries long before a stress test does. Now, if you're watching this video and thinking, I've never had these labs checked, or I've never had my heart risk mapped out like this, or I want a proactive plan, not a reactive response, here's what you need to do. Ask your primary care provider to check these labs and images for you at your next visit. But do know that not all doctors are familiar with how to interpret the results of these tests. So, if your doctor isn't comfortable with ordering and/or interpreting these tests, then please find one who is. Remember, heart disease is the #1 killer because we look too late. My goal is to change that because your arteries are aging whether you check on them or not. But the sooner you know your risk, the sooner you can change your future. If you're serious about longevity, metabolic health, advanced labs, and your health, hit subscribe right now because the videos I post will break down the tests, tools, and strategies we use to help people stay strong and live longer. Again, I'm Dr. Kabir Harricharan Singh, and your heart deserves VIP treatment.